Hello everyone, my name is Kagiso, Dipholo, the infection control focal person for the hospital, Sekgoma Hospital. Today I'll be briefing the community staff and patients about the precautions that they need to take when they're in the hospital, about how to prevent infection. What is infection? Infection is whereby germs or pathogens enter your body. These germs can be bacteria, protozoa, fungi, and viruses, and they cause an illness. They multiply to cause an illness. So what are the precautions that patients, staff, community need to take when they're in the hospital to prevent this infection? There are a few key precautions that the patients need to take based on the types of infection that they may take. The first one can be hand hygiene. Second one, waste management. Third one, environmental cleanliness. The fourth one, respiratory etiquette. What are the types of infection that we can get? There are many routes that we can get infection through. You might get infection through respiratory. This can be TB, influenza, and other infections that can go through respiratory system. Other infection can be contact infections. What are contact infections? These are infections that we can get when getting in contact with any surface or a patient who have an infection that is transmitted through contact. So when you look into contact infection, what are the precautions that we can take? The critical one is hand hygiene. Hand hygiene is whereby you wash hands through using soap, water, then disposing waste properly. Then respiratory infection. What are the precautions that we need to take when we want to prevent respiratory infection? This is whereby you use masks and keeping distance from other patient staff. Then also disposing any tissue or material that we are using to take off any secretions from the respiratory system through the nose or the mouth. Okay. How can we prevent respiratory infection? There are personal protective equipment that we use to prevent respiratory infection. So we've got the respiratory mask that we can use when we have common flu or we have any infection that is transmitted through the respiratory system. So this mask can be given to patients, community, and is also used by staff. So how to wear the respiratory mask? There is a string that you need to consider when putting on the mask. It has a chip inside that helps you to mold your nose. So this is how you wear the mask. Then the chip that I have talked about is right on top of your nose. You will angle it so that it occupies your nose properly. Then you also have the N95 mask. This one is used whereby there is an infections like TB or any infection that is highly infectious, like COVID-19. This is the mask that we usually use. This one also can be used for a period of 30 days in case you are assisting a TB patient. So this mask, we don't usually give it to the patient because it's complex to fit. It is usually used by staff. For visitors and patients, we use this respiratory mask. So how can you put on the N95 mask? This is how an N95 mask looks like. Then it also have a chip that is used to mold your nose. So it is very important when using this mask on respiratory infection like TB to label it, because you can reuse it for a period of 30 days. So I'll be demonstrating how you can put on the N95 mask. Then you make sure you mold it so that it can fit properly in your nose. So another reason why we don't give this mask to patients who have respiratory infection like TB, it's called N95 because the filtration rate is at 95%. It's also, this N95 means it's resistant to oil. So if you give this mask to a patient who have a condition like TB, they can have a compromised breathing pattern because the air filtration is very minimal in the N95 mask. Thank you. There are 5 moments of hand hygiene whereby you need to consider when we are in the healthcare setting, especially staff and patients. Patients they are encouraged to wash hands before taking medication, and also when touching the surrounding of the bed that they are sleeping at. And also community, they are encouraged to wash hands whenever they visit the hospital and they exit, because there's a possibility of getting infection by touching the surrounding of the patient. So staff, they are encouraged to wash hands before giving the patient medication, when touching the patient's surrounding, when using the bathroom, also when exiting the working area. So I'll be demonstrating on how to conduct hand hygiene. Like I mentioned, you can get contact infection by touching areas that are exposed to infection when helping the patient. So it's encouraged, or every time you are assisting the patient, you have to always wash the hands before you go to the next patient, or before you can issue the patient medication. Then after helping the patient, you are also expected to wash hands. So this is my demonstration on how to wash hands. First, you wet your hands. Then you after wetting the hands, you pour a little salt. Then you make sure you use leather. When performing hand hygiene, be mindful between the fingers. So it's encouraged to always wash between the fingers, because that's where some bacteria and viruses can be stuck in between, or any dirt. Then you do this circular motion within the palm so that you can cleanse your nails. Then you can rinse your hands so that you remove all the dirt and the soap that you use. After rinsing the hands, you use elbows to close the tap. Then you go to your paper towel. Then you can use the knee to unfold the paper towel. Then get enough paper towel to dry the hands. Make sure you dry the hands. Then you dispose the paper towel in the domestic. Yeah, it's very important to dispose the waste that the paper towel to domestic waste bin, because the final disposal of waste, we've got the clinical waste and domestic waste. So like I mentioned, the other way of preventing infection is proper waste management. So waste need to be segregated properly so that clinical waste can be taken to the incinerator for final disposal, to avoid exposing to the community when disposed in the domestic landfill. So domestic waste will go to black plastics for final disposal at the landfill. Then clinical waste can be sharps, can be any material that we have used in the patient, can be gloves, anything that have been in contact with the patient that we might feel or it can cause any harm when exposed in the domestic landfill. So it's very important to segregate waste so that the clinical waste can be taken to the incinerator. The other waste that we produce when assisting patient is sharps. Sharps are also disposed in a sharps container